Namaste, I'm Dr. Ashwin Sawant. I'm an Ayurvedic physician from Mumbai, and I'm thankful to Department of Sanskrit, Mumbai University, for starting this beautiful series of lectures under the heading of Indian Knowledge System, that is IKS. And under this heading, today I'm going to present surgery in ancient India. So as soon as I say surgery in ancient India, eyebrows will definitely raise of historians and modern scientists and modern doctors, having the doubt whether there was surgery in ancient India or surgery in Ayurveda was there or not. So before going to the subject, let us see references of some ancient Indian text which indicate surgery. This first reference is from Rigveda, which states that injured wife of King Khela was offered metallic limb and was made capable of walking. Rishi Paravruk was given vision. In Kaushik Sutra we find reference of herbal treatment of weapon injury, bleeding and fracture. In Atharvaveda we find references of various human body parts. In Jaimini Brahman there is a reference stating that young boy's body which was damaged under the horse cart was reconstructed. These are some more references which state about the Madhuvigya, that is organ transplantation, and Pravarga Vidya, that is plastic surgery, and references of these two branches of surgery is mentioned also in Brihadaranyaka Upanishad and in Shatapada Brahmana. In Rigveda again there is a reference where blind Kanva was given vision. In Atharvaveda, the last column you can see, removal of fetus by puncturing the uterus, that is the modern caesarean section. Comparatively recent references from Mahavagga where reference of cranial surgery is there. Use of charms, a signet ring as a healing talisman for the cure of snake bite, is from Malavika Mitra. In Malavika Mitra we find the reference of expert of toxicologies also. In Manusmriti we find the reference of surgeon where a rice which is cooked by surgeon was prohibited to be eaten by a common man. Now looking after all these references, and then there are many other references which I haven't studied here, question will arise in mind whether these are the references which indicate actual surgery or this is a mythology. So before going to the subject, I would like to give you the glimpse about the 8 branches of Ayurveda. Kaya, Bala, Graha, Urdhvanga, Shalya, Danshtra, Jara, Vrushana. These are the 8 branches of Ayurveda. In modern medicine also, today there are various branches of medicine. In the same manner, there are 8 branches, and among them Shalya Tantra or surgery was one branch. Now what is the meaning of Shalya? Shalya is Mana Sharira Badha Karani Shalyani. Any object or anything which hurts or injures or damages the mind and the body, mainly body, removal of that Shalya, that object or that hurting thing, is called Shalya Tantra or surgery. In ancient India, there were 2 schools of thoughts or 2 types of schools of medical world. One among them was called Atreya Sampradaya and another was Dhanvantar Sampradaya. The credit of Atreya Sampradaya goes to the Saint Atreya who started it, and all this knowledge was derived from the Brahma, and how the tradition was flowing for ages is mentioned here. And another Sampradaya, that is Dhanvantar Sampradaya, which is surgery. That credit goes to Dhanvantari, and Dhanvantari's pupil was Sushruta. Hence the Sushrut Samhita is the first text of surgery. How was this created? We can see that Dhanvantari was a teacher who narrated Sushrut Samhita to his pupil who was Sushruta. So there were 2 Sushruta. One is senior Sushruta whose timeline is approximately 1500 BC, or it may go beyond that, but not before 1500 BC. And then there was a junior Sushruta who was there in 2nd century AD. And this is the reason why many modern historians, specifically European historians, were considering that Sushruta Samhita was created in the 2nd century AD, whereas this Sushruta is a junior Sushruta. Main Sushruta who learned surgery or Shalyatantra from Dhanvantari, that is King Divodas, his timeline was 1500 BC. Further, this Sushruta Samhita was re-edited by Nagarjuna in 5th century AD. Again, it was revised by Chandrata in 10th century AD. It was commented by Gayadas in 11th century AD. In Chakrapani Datta again commented on it in 11th century AD. And Dallana, whose commentary Nibandha Sangra is very famous to understand Sushruta Samhita, was written in 12th century AD. So we can see that approximately for 3000 years editing and rewriting of Sushruta Samhita was going on. This could be the only example that one text was constructed in 2 to 3 millenniums. So we can say that Sushruta Samhita was narrated by the King Divodas and it was written by Sushruta. We find references of King Divodas, that is Dhanvantari, and Sushruta in various ancient texts. Rigveda, Kaushitika Brahmana, Kaushitaki Upanishad, Mahabharata, Atharvaveda, Ashtadhyayi of Panini, Mahabhashya of Patanjali, Katya and Vartika, and Ruk Sarvanukramani. So these are very ancient texts who give references of either King Divodas, that is Dhanvantari, or Sushruta, who was a writer of Sushruta Samhita. Now this is the timeline of Sushruta which is suggested by some historians. Rudolf Harley, who was a famous historian who studied ancient Indian sciences and he had concentrated mainly on Ayurveda and surgery, he has given the timeline as 600 BC. Priyavat Sharmaji, the great Ayurvedic historian, he has proved it to be 1500 to 1000 BC in his book Scientific History of Ayurveda. And Nilesh Ogji, the modern historian, has with the references he has said that it could be earlier than 5561 BC. Now let me tell you that Nilesh Og is a modern historian who gives references of geology, archaeology and computer technology, and his references, his evidences have never been challenged in last couple of years, and we can say that his timeline seems to be perfect. Now let us go to the main subject. You should know that Sushruta Samhita is the first text to elaborate importance of accurate knowledge of anatomy for successful surgery. If you want to become a good surgeon, you must have a perfect knowledge of anatomy, and that has been stated by Sushruta. He was the first person to demonstrate method of human body dissection. Human cadaver was dissected in India approximately 3000 years back. This may not be believed by modern historians and modern scientists and modern doctors, but a complete procedure of human cadaver dissection is described by Sushruta, and this is how they used to gain the knowledge of human body. He was the first person to stress importance of both theoretical and practical knowledge to become an expert surgeon. He was the first to define qualities of a surgeon. Sushruta Samhita is the first text to describe the selection criteria and ethics of students of surgery. This is just like the modern age in 21st century too. We have to select students by, they have to go through certain tests, certain exams, and there is selection criteria. In the same manner, selection criteria is mentioned in Sushruta Samhita. Not only that, he tells about the ethics of the surgery which are to be followed by student. He claims requirement of governing authorities' permission before starting surgery. Is this not what is followed even in modern days? So you are supposed to take license or registration before doing surgery, before starting your practice, and that too is mentioned in Sushruta Samhita. Sushruta Samhita was the first text to understand responsibility and duties of surgeon before entering into profession. It is just like taking oath, and he was the first to describe surgical ethics. Ancient references of well-equipped team of surgeons is found in Mahabharata. Mahabharata, Bhishma, the great warrior, when he was wounded in the war, the expert surgeons, well equipped with surgical instruments and appliances, came to treat his wounds, and this is the reference here in front of you. Now, when we see the reference, do we have actual description of it in Sushruta Samhita? Let us see. These are the special qualities of a surgeon. Shauryam ashukriya sastra taishnyam asveda vaipatu asammohasya vaidyasya shastra karmani shasyate. What are the special qualities of a surgeon is described here. You can see. Which surgical instruments were used? As we see the reference in the Mahabharata, where a team of surgeons came with appliances, with instruments. Now, what were the instruments used in ancient India? They are described in Sushruta Samhita. 20 types of sharp instruments and 101 types of blunt instruments are described, which were made from the special steel by an expert blacksmith. Various qualities and defects of surgical instruments are described to avoid errors in the surgery, method of how to hold it, method how to precisely use it, and method and exact indication of each instrument. Everything is very well described in Sushruta Samhita. These are the pictures of 20 sharp instruments. Here there is a reference for you, so that if you want you can go through the original text of Sushruta Samhita. These are the defects of sharp instruments. What are the 8 defects? If an instrument is easily bending, if it is blunting, if it breaks by pressure, if it is jagging, if it is too thick, too thin, tall, too long, or too short. These are the 8 defects which should not be there in surgical instruments. Ages of sharp instruments. Now, see, these are in the middle column. You can see Vruddhipatra and Mandalagra Shastra. These instruments had the age which is the size of lentil, which were used for incision. Now in second column you can see, in second row you can see Nakashastra, which was used for scarification or for Lekhan Karma. It had a size of the sharpness was of half of a lentil. The Kutharika Shastra, needles and Kushapatra were used for puncturing and evacuation, and the size was of human hair. And lastly Vruddhipatra, that is scalpel. The age of the sharpness of the Vruddhipatra or scalpel was half of human hair. Just imagine 3,000 to 5,000 years back, our ancestors could make a surgical instrument which had age of half of human hair. We find in Atharvaveda reference of transplantation. Attachment of lamb scrotum to human scrotum is mentioned in Atharvaveda, and the same reference is found in Ramayana Balakanda and also in Jaimini Brahman, which states its authenticity. Now, whether such transplantations were actually done, and do we find reference of such a transplantation in Sushruta Samhita? Let us see. Plastic surgery of cleft lips or cut lips is mentioned in Sushruta Samhita. Plastic surgery of amputated nose, plastic surgery of punctured ears, and punctured ears, how to reconstruct is that punctured ear. There are 15 types of methods are described. Here are the names of those 15 methods of Karana Sandhan Vidhi, that is 15 methods of plastic surgeries of punctured ears. Ancient reference of cranial or skull surgeries. The first one is in Mahavagga. Reference is given that Jivaka, personal surgeon of Buddha, practiced cranial surgery successfully. In Bhoja Prabandha too, we find the reference where King Bhoja's cranial surgery was done by using some drug known as Sammohini to make him unconscious, and then Sanjeevani was used to make him conscious. So this indicates that they knew that cranial surgery could be painful and patient has to be unconscious during the surgery. And the reference of cranial surgery is also found in Sushruta Samhita. Now here we find one archaeological evidence of trepanization. This is trepanation was considered to be a method which was followed in Chile, ancient Chile. But surprisingly, in Kashmir we have found some skulls where trepanation was done. That is making a hole in the skull. Now to make a hole you need to have a particular instrument, because skull is very hard, the bone of the skull is very hard, and those instruments were available in ancient India, and its reference is here in front of you, which was found in Kashmir, and its reference or the research paper was presented in International Journal of Osteoarchaeology. The reference is here in front of you, and that timeline is considered to be 2350 to 2050 BC. Here is one reference from Rigveda where it is said, bleeding of the neck was arrested without bandaging it by surgical procedure. Now this means that they knew various methods of stopping the bleeding, of arresting the bleeding. Now whenever you do the surgery, bleeding will definitely occur, and you should know how to stop the bleeding. So what are the methods which were followed in ancient India, which are described in Sushruta Samhita? Let us see. Sandhana, Skandana, Pachana, Dahana and Bandhana. Sandhana is application of astringent decoctions. Skandan is coagulation of blood by cold compression. Is this not what is also followed in modern days? Pachana, drying the wound by sprinkling ashes of astringent herbs. And Dahana, that is cauterization. When bleeding doesn't stop by other methods, by normal procedures, cauterization is done, and this too was followed in ancient India as mentioned in Sushruta Samhita. And the last one, if a big artery is cut and you cannot stop bleeding by any other measure, ligaturing is done. That is called bandhana. And what was used? Ship's gut was used for ligaturing the blood vessels to stop bleeding. And this reference you can find in Ashtanga Sangra. Reference is there in front of you. This text was written in 6th century AD. Organ transplantation, which is known as Madhuvidya, reference is found in Rigveda, which states Ashwini Kumar's two brothers, who were physicians and surgeons, learned the skill of organ transplantation from Dadichi, son of Atharva. Now what some more references are there. Ashwini Kumars learned the skills of plastic surgery from Twashtru, who had learned it from Indra. And one more reference at bottom you can see, injured boy's body was normalized by Sandhana treatment, whose body was damaged and it was cut, it was reconstructed by Sandhana treatment. And this Sandhana treatment is nothing but reconstructive surgery or plastic surgery. Now let us see what made Europeans start thinking about Sushruta Samhita. This was the incident. Now the picture which you see is of Kavaji, who was a bullock cart driver, and his nose was cut by the soldiers of Tipu Sultan in the war between Tipu Sultan and Marathas, and his nose was reconstructed in India in this city named Pune, and it was observed by two British officers, and they wrote their first presentation. They did their presentation in Royal Academy of British, and it was shown that how the cut nose was reconstructed by Indian potter. This surgery was done by a potter that was in Pune. And let me tell you how this method is described in Sushruta Samhita. This is the exact description from Sushruta Samhita. This is a complete shloka which is explaining the reconstructive surgery of cut or amputated nose. How it is to be done? Take a leaf and cut it in the shape of victim's nose. Keep the same leaf on his cheek and cut skin as per the shape of that leaf. Place that skin on the area of nose in a manner suitable to form a nose and stitch it. Lift the skin and give it the shape of nose. Insert two small bamboo tubes to create openings of nostrils. Sprinkle medicated powders of Chandan, Jeshtimad, Rasanjan for healing that wound and apply cotton dipped in medicated oil. Friends, it is difficult to believe that this method is described in ancient Indian text which was created before 1500 BC. Now, surprisingly, in Italy, in the year, say somewhere around, I should say in 1721 or somewhere, this method was developed in Italy and it was called as Tagliacozzi's innovative surgical technique. Somehow it is said that some Europeans visitors who had visited India and who had seen this surgery, they misunderstood the method and they reconstructed they tried to do this reconstructive surgery, but they attached the amputated nose to the left arm, and that person was supposed to be in that position for a couple of weeks, and this was the wrong method because they misinterpreted it or they misunderstood it. Actual method is something different, and surprisingly this method of reconstructive surgery of nose was you can see the flow, you can see the various timelines and how it was going on in European countries. In Sicily, Venice, it was there initially in 1400 to 1500 AD. Further, Giulio Aranzio, professor of University of Bologna, and he used to run the classes of rhinoplasty. Then again in 1597, Gasparov Tagliacozzi published this particular document which explained how to reconstruct the nose and ears, and you can see he was considered father of plastic surgery, and the method which he followed was somehow is travelled from India to Italy through some visitors, and since it was not properly understood, they did it in a wrong way. And you can see that this as I show you one photo of a bullock car driver, this Kawasji. This operation was seen by British surgeons Thomas Crusoe and James Findlay, who wrote article in Gentleman's Magazine in 1794 AD. Further, again it was forgotten, and Joseph Constantine, who is considered a very influential man in modern surgery, he learned this procedure in India. He came to India and he learned this procedure, and then further it was slowly spreaded all over the India. Now, Sushruta Samhita has described the fetal development month by month. Surprisingly, the archaeological evidences of fetal development can be seen in this temple from Tamil Nadu, which is also seen in one temple in Thrissur, Kerala, where these carvings are there, where fetal development is shown. Now, in present modern days, we can see this with the help of ultrasonography. Now, question arises, how could our ancestors imagine the development or the growth of fetus in this manner, in such a preciseness? This you can see. Now, method of obstetric manipulation for easing the delivery is mentioned in Sushruta Samhita. Now question arises, do we have any evidence? Yes, we do have. This carvings or this sculpture is from the Ayurveteshwar temple from Kumbakonam, Tamil Nadu, which is of 12th century CE. And here we can see that at the left hand one lady is preparing the medicine, and two nurses or two assistants are helping this lady who is pregnant to in her delivery. You can see below her legs there is a net which is tied to her thighs, and this is by chance if fetus falls, baby falls from the comes out of the vagina, if he falls, he should be caught in that net. This is the method of a normal delivery, and these are the references which indicate how to manipulate and help the delivery. Again, one more sculpture is here in Pungampadi Shiva temple, where mother giving birth in a standing posture is shown. In one more picture you can see that a childbirth in a standing posture which is assisted by nurse is shown. Now let me tell you, this method of delivery in India was followed for thousands of years, wherein a mother has to stand and deliver a baby. In modern days, a lady is supposed to sleep in the supine position on the bed. Now let me ask you one simple question. Is it possible to pass your stool in a sleeping position? It is not possible. In the same manner, when you are lying on the bed on your back, it is difficult to give proper pressure to deliver the baby, and this fact was well understood by our ancestors, and hence deliveries were done in a standing posture. Again, there is one more sculpture which is here. You can see the manipulation which I have mentioned. It is described in Sushruta Samhita that how two nurses or assistants can help a lady by doing some manipulation and making the delivery easy and comfortable. Here is references of caesarean section. One is from Rigveda and one is from Atharvaveda, which states extraction of dead fetus from live mother's womb. Now here we find one sculpture which is presently in Museum of Kaushambi, where a fetus can be seen which is to be removed, and this is a indirect picture of caesarean section. Ancient reference of induced abortion is found in Rigveda. Address is there in front of you, and of the same is also found in Sushruta Samhita. Not same reference, but reference of abortion. Now here we can see that induced abortion is clear enough to state medical advancement in those ancient days. Procedure of extraction of dead fetus is very well explained in Sushruta Samhita. Which position should be used, which surgical instrument should be used, and how it should be used, which should not be used. Everything is well explained, which definitely states that extraction of dead fetus was done in ancient India. Now here we can see Mandalagra Shastra, and in modern days, in last centuries, this instrument was called decapitator or embryo knife. Now further it was converted into a little modern form, but this is an ancient Mandalagra Shastra which was found in archaeological excavation of Harappa. Pediatric care. Here we can see how a child is lying on the lap of this man who is a physician, and he is examining him, and you can see that pediatric care was also a part of ancient Indian Ayurveda. This is about the human cadaver dissection. Complete method is explained here. I'll give you English translation for you so that you can understand. Just concentrate on the last 2 points. It is mentioned that you are not supposed to cut the skin, but you are supposed to rub the skin with the help of a soft brush, so that you can remove skin layer by layer and you can see complete structure all the way from skin till muscle. And this method seems to be rather scientific, which gives you clear idea, clear picture of the skin's layers, then fascia, then muscle, and the whole structure very well. Here I would like to tell you that Sushruta Samhita is the text, or rather first text of this world, which describes fetal development, bones, classification of bones, of ligaments, muscles, tendons, joints. Classification of joints is also done, of veins, arteries, and heart is a center of circulation, is first stated by Sushruta. Various soft organs are also mentioned. Now Sushruta defines who is an expert surgeon. Whom should you call expert surgeon? Sharre cheva shastre cha drushtartha shat visharadah drushtashrutaabhyam sandeham iva pohaya chareta kriya. Only he can be considered as an expert surgeon who is well versed in the practical and descriptive anatomy. Hence one should start the surgical procedures only after clearing his doubts by actually watching practical of surgeries and by the guidance of teachers and text. Is this not what is followed in modern days also? In surgery, first thing a surgeon has to do is take an incision on the skin. Now Sushruta Samhita describes how one should do the normal incision, how an oblique incision should be taken, and in which parts of the body, how a circular incision should be taken and in which parts of the body, and semicircular incision, which is strictly around the penis and around the anus. This clearly states that during Sushruta Samhita, our surgeon, our ancestors very well knew importance of the incisions. Here we see one reference of Rigveda, where it is said, Shava, whose body was cut into 3 pieces, was given life by Ashwini Kumars. This is an indirect indication of reconstructive surgery. Now, to construct the body parts, you need to have needles. Which needles were used? There are various types of needles, and you can see that this length of the needles, the size of the needles, and which needles should be used in which parts is very well explained in the Sushruta Samhita. Which suture materials were used? Either horsehair or the tendons of the animals, or the fine threads made from the bark of the particular plant, which is Ashwantaka. In Marathi we call it apta, or murva guduchi tanairva. This is either other or fibers made from the plant murva or kuduchi, that is Tinospora cordifolia, were used, and which type of suture material should be used for which type of suture was also explained. Now here you can see 4 types of sutures are methods of taking sutures are explained in Sushruta Samhita. Tunna Sevani, that is darning sutures, Rujugranthi, that is interrupted sutures, Gofanika, which is like a sling, and Vellitaka, that is winding sutures. And this we should know that these sutures are still followed in modern surgery also. How the tempering of the instruments was done? It was either done in alkali or in water or in oil, and according to the tempering done of instruments, those instruments were indicated to be used in particular surgeries. These are the 8 types of surgical procedures mentioned in Sushruta Samhita: Chedana, Vedana, Lekhana, Vedana, Eshana, Aharana, Stravana, and Sivan. There is English translation there in front of you. Most of the surgical procedures required during doing surgery are coming under these 4 categories. These are the 8 surgical procedures one surgeon has to follow while doing surgery. Now we come to the 101 blunt instruments, which are called yantra in Sushruta Samhita. Defects of blunt instruments, total 12 defects are described. So surgical instrument should not be defective was well understood by during those days. Classification of blunt instruments. These are the instruments which are still used in modern surgery. Swastika yantra 24 types, Sandansha yantra 2 types, Tala yantra or spoon shaped type of instruments 2 types, tubular instruments Nadi yantra 20 types, Shalaka or probes 28 types, and accessory instruments or Upayantra 25 types. Altogether there were 101 blunt instruments or yantra. Now these are the surgical instruments which were found in excavation in Takshashila. And here you can see tongue depressor, probe, ointment applicator, decapitator, very other probes, spatulae were found, and this is the archaeological evidence we have found of surgery in ancient India. Now this is about the Mandalagra Shastra or decapitator. Various uses of Mandalagra Shastra are explained in Sushruta Samhita, where in which conditions you should use Mandalagra Shastra. One among them is enlarged tonsils, dead fetus in uterus, pterygium, which is an eye disease, new growth in the eye, and for scarifying the tongue. Here I am giving you a reference of a historian who did this research, and if you are interested you can go through that. There were some blunt instruments which had shape of a mouth of a animals. Pictures are there in front of you. These are the Sanskrit names and these are the modern names. These are the surgical instruments which had the face of birds. Kaka Mukha Yantra, Uluk Mukha Yantra, Chilli Mukha Yantra, and these are the names of modern surgical instruments which are the same. You can see Kaka Mukha Yantra became crow forceps, or Kanka Mukha Yantra is heron forceps. Now whether what I am saying that ancient Indian surgical instruments were converted into modern surgical instruments, do we have any references? Let us see. See, this is the Siyamukh Yantra which got converted into modern lion forceps, tiger forceps or Vyagramukh Yantra which became tiger jaw forceps, wolf forceps or Vrukamukh Yantra which became wolf tooth extractor. You can see the resemblance in the structure. Chillimukh Yantra or kite forceps become lower dental forceps, Grudramukha Yantra or falcon forceps become molar forceps, Makaramukha Yantra or crocodile forceps is still in use in modern surgery as a modern crocodile forceps. So even names are same. This is Kantya Shalya Avalokini Yantra, that is ancient throat speculum. This is a modern laryngopharyngoscope. More or less structure is same, and even the motto is same. Arsha Yantra, ancient rectal speculum, Ferguson's rectal speculum. Basti Yantra or ancient enema urethral syringe which become a urethral syringe. Now let me tell you, the pictures which I am showing here are used since last approximately 1 century. Presently these are converted into more sophisticated and more modern surgical instruments, but initially our ancient Indian surgical instruments were converted into modern surgical instruments. Ancient midwifery forceps or Yugma Shanku, which is mentioned as Yugma Shanku in Sushruta Samhita, became a modern midwifery force. Garbhashanku or fetus traction hook it is the same, you can see almost structure is same. Snake hood probe or Sarpafana Shalaka, the surgical probe. Suction cannula, which is used in ascites to remove the excess accumulation of the fluid in the abdominal cavity. In the same manner that one particular instrument was used in ancient India, mentioned in Sushruta Samhita, to remove the water in the ascitic patient. Wound syringe is the ancient one, this is a modern one. This is the ancient tooth elevator or Sharapunkha Mukha Shalaka, which become a modern tooth elevator. Sharari Shastra becomes Caesar. Even you can see the resemblance in the pronunciation, resemblance in the name. Sharari becomes Caesar. These are ancient urethral dilators, and these are the modern urethral dilators. These dilators were used whenever there was urethral structure, urethra or urinary opening. When it used to get constricted, these urethral dilators were used. Last one is Ardhadhara Shastra or scalpel. Overall, we can see that other than this, some accessory treatments were also recommended by Sushruta. He recommends to use black ants to bind cut intestines, and this method is now followed by modern surgery, whereas Sushruta has described it during 1500 BC. Sushruta was the first medical person to use leeches as a medical instrument to treat blood related diseases, and we should know that leech is considered as a medical device by WHO. A US FDA has given approval some years back, and Sushruta was the first person to use it as a medical device. He used Agni Karma, cautery, to treat various diseases, and on venipuncture, or which is called a Shiravyadhan, there is a separate chapter which describes everything about the venipuncture. Practice of surgical procedures. Now, if you want to be a surgeon, you should practice it on some non-living organs or non-living things before actually doing the surgery. Before actually using a surgical instrument on live body, you are supposed to do the practice, and that has been described in Sushruta Samhita, that Shedan should be done on watermelon or gourds or pumpkin or cucumber, that is on long and big fruits. Incision and Bhedan in the same manner. Scrapping should be done on a piece of a dead skin where hair are remaining, so that you can learn how to scrap the skin. Puncturing should be done on the veins of a dead animals. Probing should be done either in the on the bamboo or on the wood eaten by the worms, and extraction should be done. Practice should be done on the jackfruit or a pumpkin by withdrawing the seeds. So this is how these surgical procedures were practiced before actually doing the surgery. You can see how drainage should be done. You can do it on the surface of a particular plant flank, covered with a coat of beeswax. So how you should learn how to do the drainage. Suturing was done on the pieces of cloth or dead animal skin. So once you are used of suturing the dead animal skin, then one day you can do it on the live human being skin. Venesection was done, that also was done on either on the dead animal or on the lotus stem. Bandaging was either done on a limb or on a body full-sized doll, or which is stuffed with the linen. Cauterization done on a piece of a soft flesh, of course of an animal. How many references we find in Rigveda? Among them one which I have mentioned first, that Vishpala, wife of the king Kela, whose leg was cut in the war, was replaced by an artificial metal limb, and she was made capable to stand in the war. This may be really difficult to believe, that how could Indians during those days, thousands of years back, could do such surgery and made one injured woman capable of standing in the war by providing a metal made limb, that is artificial limb. So here we see what are the references about the fractures and dislocations. You can see that 12 types of fractures and 6 types of dislocations are described in Sushruta Samhita. causes, general and specific features, and even prognosis is well explained. Fracture bed is suggested. Different types of fixation of the fractured parts depending on the site of fracture is recommended, and use of splints for supporting broken bone was also used. This explains why we find reference of metallic limb in Rigveda Samhita. These are the marmas, or 107 vital spots in the body which are supposed to be avoided while doing surgery. So during surgery you must avoid these vital points which can be injurious to body. What was the method of anesthesia? If such surgeries were done, what was the way of anesthesia? So Sushruta Samhita mentions that use of strong wines was used before operation to relieve the pain of surgery, and in one reference we find that inhalation of fumes of Indian hemp, that is cannabis, was used as an anesthetic to make him semi-conscious and also to relieve his pain. Arrest of bleeding. Whenever surgery happens, bleeding will definitely take place. How were they stopping the bleeding? These are the methods which we have already gone through them. Sandhana, Skandana, Pachana, Dahana and Bandhan. Treatment of abscess. While doing operation or while using scalpel on the skin, abscess will definitely happen. And if a surgeon doesn't know how to treat an abscess, how to treat a wound, he will never be successful in his surgery. And these are the methods of or steps of treatment of abscess. Vimlapanam, Avasechanam, Upanaham, Patanam, Shodhanam, Ropanam and Vaikrutapaham. Let me tell you, till healing, all these steps are as per the modern science only. Modern surgery too is following these methods. But restoring the natural color and skin, Vaikrutapaham is the step which is mentioned only in Sushruta Samhita, which demands that injured skin or damaged skin by the surgery should be made normal by particular treatment, particular medicines. Various types of bandaging. 17 types of bandagings are mentioned. Loose bandage is defined, tight bandage is defined, where it should be used, where it should not be used, site of each type, position of the knot, types of knots, changing bandages as per season, which is not followed in modern medicine, but Sushruta Samhita describes about it, that on which day bandage should be changed in the summer season, and after how many days it should be changed in winter season. So according to season also there were changes in the bandaging which tells their precise knowledge about the bandaging. Surgical wards are mentioned. Patients suffering from surgical disease or those who have undergone surgeries were supposed to be kept in separate surgical wards. Again, there is a reference of operation table. We can say special board was used as a operation table. Here we are looking at the pre-operative care. Now, actual operation, before doing operation, there are some measures which are strictly to be followed, which is called as pre-operative care, then operation, and then post-operative care. Here we can see 1, 2, 3, 4, 5, 6 steps are described in Sushruta Samhita, though they are from various chapters, but when you bring them together we can understand that these are the precise pre-operative care measures. These are post-operative care measures. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and 11. We find 11 steps of post-operative care where everything is thought of, and you can see those underlined 5 steps which were only to prevent infection. Now whoever thinks that when they were doing surgeries in ancient India, what about infection? They were definitely worried about the infection, and to avoid infection, to avoid any entry of microbes, some steps were definitely followed, and they were preventing that infection. Here I am showing you a teeth which was found in Mehergarh in Pakistan during 4000, which is said to be the reference of this tooth, and the drilling done on this tooth is the reference you can find in journal Nature in April 2006, Nature journal. And this excavation was done in Mehergarh in Pakistan, which is of course ancient India, and this clearly states earliest evidence of dentistry in Mehergarh, and the timeline of those tooth is 7000 BC, which clearly indicates that certain procedures were done on the tooth and certain instruments were also available to do those dental procedures. Now here we see dentistry in ancient India. Now one thing is that this reference of the various tooth which were drilled found in Mehergarh in Pakistan, and further let us go. Which operations were done in ancient India? Which operations were done? Let us see. Cranial surgery, scrotal surgery, abdominal surgery, bone abscesses, suction of fluid in ascites, that is called tapping, removal of urinary stones, surgery of fistula in ano, and intestinal perforations. These are the surgical operations which were done. Other than that, tonsillectomy, removal of tonsils, extraction of an injured eye, removal of scrotal injury, ophthalmic operations like cataract surgery, methods of obstetric manipulation, extraction of dead fetus from the womb, udarpatana, that is caesarean section when normal delivery is not possible. Now here I am giving you the idea or the picture of the cataract extraction which is done by extracapsular method and which is described in Sushruta Samhita. Pre-operative care is mentioned, then actual operative technique of cataract surgery is described, and post-operative care too is mentioned. So what is to be done, what should not be done, what is to be avoided, everything is precisely mentioned, which clearly indicates their perfection in cataract surgery. Here we can see the reference of one surgeon who was present in 1034 CE, and this is from the temple which is in Andhra Pradesh, in present day it is Telangana. That surgeon's name was Agalavya, a surgeon, and whatever is written here is, I am showing you here. Agalavya was a proficient in Shastra Shastra, that is the science of surgery. It is further emphasized in this description when one comes to know that any treatment by surgery was made and the patient got the relief, that is due to Agalavya and King Jagadeka Malla. Even when a disease was found incurable by other physicians in Parakarsha, serious stage, and its upakrama or treatment, they say in all quarters, in all regions, that Agalavya or Agalaya was most efficient in curing that disease. This is the epigraphic evidence of surgery in ancient India. Here are references, so if you want to check, you can go through that. This is also again some written sculpture you can see, which is from Tirumukkadal temple from Tamil Nadu, and the period is said to be of 11th century AD. This is the inscription, what is written, and this is I am showing you here for you. Now here I am showing you how Sushruta Samhita was translated long back by various countries or in various languages. In Prakrit language it was translated by Vasubandhu, timeline is 350 to 360 AD. In Arabic between 531 to 572 AD. Again in Arabic by Ismail ibn Bulbul in 753 to 754 AD. And what I mean to say here is this, that this translation traveled from India to Arabic countries, and Arabic learned those surgical procedures, that surgery, they understood about those surgical instruments, and from Arabia or from Arabic countries it went to Greek, and from Greek it was spreaded all over the Europe. So basically the surgery of modern science of modern European countries, their roots are here in India. Here we can say that for thousands of years we were thinking that surgery is not a part of Ayurveda. There was no surgery in ancient India. But all these references clearly indicate that there was a precise and perfect science of surgery in ancient India, and this is what I have tried to show you, and I am sure you must be happy and feeling proud to know that in ancient days there was a developed science called surgery in ancient India. Thank you so much.